Let's dive right in.
1. The nurse is assessing a patient with suspected tuberculosis. Which findings support this diagnosis? Select all that apply. A. Night sweats. B. Persistent cough 3 weeks. C. Weight gain. D. Hemoptysis. E. Fever. F. Bradypnea. Answer: A, B, D, E. Rationale: classic TB symptoms include fever, night sweats, chronic cough, hemoptysis, weight loss. Strategy: choose systemic infectious signs plus respiratory symptoms. 2. A patient with hyperthyroidism is being assessed. Which findings are expected? Select all that apply. A. Heat intolerance. B. Weight loss. C. Bradycardia. D. Tremors. E. Insomnia. F. Constipation. Answer: A, B, D, E. Rationale: hypermetabolic state causes tachycardia, weight loss, insomnia, heat intolerance, tremors. Strategy: think everything speeds up. 3. The nurse is caring for a client with severe asthma exacerbation. Which interventions are appropriate? Select all that apply. A. High Fowler's position. B. Administer short-acting beta agonist. C. Initiate 4 corticosteroids. D. Encourage pursed lip breathing. E. Administer long-acting beta agonist. F. Apply cool mist humidification. Answer: A, B, C, D. Rationale: acute attacks require bronchodilators plus steroids, long-acting beta agonists are for maintenance. Strategy: eliminate chronic use medications. 4. A patient with acute kidney injury has hyperkalemia. Which ECG changes are associated? Select all that apply. A. Peaked T waves. B. Widened QRS. C. ST depression. D. Flat P waves. E. Prolonged PR interval. F. Tall R waves. Answer: A, B, D, E. Rationale: hyperkalemia affects conduction leading to peaked T, widened QRS, flattened P, prolonged PR. Strategy: focus on conduction delays plus tall T waves. 5. The nurse is evaluating a patient for metabolic acidosis. Which conditions can cause it? Select all that apply. A. Severe diarrhea. B. DKA. C. Renal failure. D. Vomiting. E. Lactic acidosis. F. Hyperaldosteronism. Answer: A, B, C, E. Rationale: diarrhea loses bicarbonate, DKA and lactic acidosis produce acid. Renal failure retains acid. Strategy: identify acid gain or bicarbonate loss. 6. A patient receiving total parenteral nutrition, TPN, is at risk for which complications? Select all that apply. A. Hyperglycemia. B. Infection. C. Hypovolemia. D. Electrolyte imbalance. E. Thrombophlebitis. F. Metabolic alkalosis. Answer: A, B, D, E. Rationale: TPN infection risk, high glucose, electrolyte shifts, catheter complications. Strategy: think central line plus high glucose. 7. The nurse is preparing discharge teaching for a patient with chronic heart failure. What should be included? Select all that apply. A. Monitor daily weight. B. Restrict sodium. C. Report 2 to 3 pounds weight gain in 1 day. D. Limit fluid intake. E. Increase potassium-rich foods. F. Take NSAIDs for pain relief. Answer: A, B, C, D. Rationale: sodium/fluid control plus weight monitoring essential. NSAIDs worsen HF. Strategy: avoid drugs that cause fluid retention. 8. A client with stroke is at risk for aspiration. Which actions reduce this risk? Select all that apply. A. Chin tuck swallowing. B. Thicken liquids. C. Place in Fowler's position. D. Use straws. E. Oral care before meals. F. Small bites and slow feeding. Answer, A, B, C, E, F. Rationale, straws increase aspiration risk. Strategy, eliminate actions that increase fluid velocity. 9. The nurse receives a patient with suspected septic shock. Which assessments require immediate action? Select all that apply. A. Map 55 mm of mercury. B. Warm flushed skin. C. Lactate greater than 4 millimoles per liter. D. Bounding pulses. E. Altered mental status. F. Bradycardia. Answer, A, C, E. Rationale, MAP less than 65, high lactate, altered LOC indicates severe shock. Strategy, recognize signs of poor perfusion. 10. The nurse is caring for a patient with Cushing's syndrome. What findings are expected? Select all that apply. A. Truncal obesity. B. Moon face. C. Hyperkalemia. D. Hypertension. E. Fragile skin. F. Weight loss. Answer, A, B, D, E. Rationale, excess cortisol HTN, obesity, thin skin. Strategy, think too much steroid. 11. A patient with Addisonian crisis is admitted. Which interventions are priorities? Select all that apply. A. For hydrocortisone. B. Large volume 4 fluids. C. Monitor potassium. D. Administer epinephrine. E. Strict intake and output. F. Administer sodium bicarbonate. Answer, A, B, C, E. Rationale, crisis hypotension plus hyperkalemia, treat with fluids plus steroids. Strategy, think BP plus potassium stabilization. 12. The nurse is teaching a patient beginning warfarin therapy. What instructions are necessary? Select all that apply. A. Report bruising. B. Keep vitamin K intake consistent. C. Avoid NSAIDs. D. Wear medical alert identification. E. Avoid all vegetables. F. Check INR regularly. Answer, A, B, C, D, F. Rationale, consistent vitamin K intake, bleeding risk, monitoring required. Strategy, avoid extreme restrictions. 13. The nurse is assessing for fluid overload in a patient with renal failure. Which findings indicate excess fluid? Select all that apply. A. Jugular venous distension. B. Crackles in lungs. C. Weight loss. D. Bounding pulse. E. Hypertension. F. Dry mucous membranes. Answer, A, B, D, E. Rationale, overload shows vascular congestion. Strategy, eliminate dehydration findings. 14. A patient with increased ICP is admitted. Which interventions reduce ICP? Select all that apply. A. Elevate HOB 30 degrees. B. Maintain neck alignment. C. Suction only when needed. D. Give hypotonic fluids. E. Administer stool softeners. F. Cluster nursing care. Answer, A, B, C, E. Rationale, avoid activities that increase intrathoracic pressure. Strategy, avoid clustering care. 15. A client with liver cirrhosis is being evaluated. Which findings are expected? Select all that apply. A. Ascites. B. Spider angiomas. C. Jaundice. D. Increased albumin. E. Petechiae. F. Hysterexis. Answer, A, B, C, E, F. Rationale, liver failure lowers clotting plus albumin. Strategy, think bleeding plus fluid shift. 16. The nurse is caring for a client with Guillain-Barré syndrome. Which findings are expected? Select all that apply. A. Ascending muscle weakness. B. Hyporeflexia. C. Respiratory depression. D. Hyperactive deep tendon reflexes. E. Facial paralysis. F. Sudden loss of consciousness. Answer A, B, C, E. Rationale: GBS causes ascending paralysis, weak reflexes, possible respiratory failure, and cranial nerve involvement. Strategy: remove hyperreflexive or seizure-like signs. 17. A patient receiving vancomycin is at risk for which adverse effects? Select all that apply. A. Ototoxicity. B. Nephrotoxicity. C. Red man syndrome. D. Hypertension. E. Thrombophlebitis. F. Hyperglycemia. Answer A, B, C, E. Rationale: vancomycin is kidney toxic, ear toxic, can cause infusion reactions, and may irritate veins. Strategy: focus on infusion-related and renal complications. 18. The nurse assessing a patient with hypocalcemia expects which findings? Select all that apply. A. Positive Trousseau sign. B. Positive Chvostek sign. C. Tetany. D. Hypoactive bowel sounds. E. Laryngeal stridor. F. Seizures. Answer A, B, C, E, F. Rationale: low calcium increases neuromuscular excitability. Strategy: choose spasms and irritability symptoms. 19. A patient with liver failure is receiving lactulose. Which findings indicate it is effective? Select all that apply. A. Decreased ammonia level. B. Improved mental status. C. More frequent bowel movements. D. Abdominal rigidity. E. Reduced hysterexis. F. Increased bilirubin levels. Answer A, B, C, E. Rationale: lactulose lowers ammonia, improving cognition and reducing hysterexis. Strategy: eliminate signs of worsening liver failure. 20. A patient with a chest tube for pneumothorax is being monitored. Which findings require intervention? Select all that apply. A. Continuous bubbling in water seal. B. Tracheal deviation. C. Sudden increase in dyspnea. D. Drainage greater than 100 milliliters per hour. E. Absence of titling. F. Drainage color turning bright red. Answer A, B, C, D, F. Rationale: bubbling equals leak, tracheal deviation equals tension, high/bright red drainage equals bleeding. Strategy: pick signs showing obstruction, leak, or acute deterioration. 21. The nurse assesses a patient suspected of hypovolemic hyponatremia. Which findings support this? Select all that apply. A. Orthostatic hypotension. B. Tachycardia. C. Dry mucous membranes. D. Seizures. E. Confusion. F. Bounding pulse. Answer A, B, C, D, E. Rationale: low sodium plus low volume causes CNS irritability and dehydration signs. Strategy: remove anything showing fluid overload. 22. A patient with DKA presents with which classic findings? Select all that apply. A. Kussmaul respirations. B. Fruity breath odor. C. Polyuria. D. Hyperkalemia. E. Bradycardia. F. Metabolic alkalosis. Answer A, B, C, D. Rationale: DKA metabolic acidosis plus dehydration plus potassium shift. Strategy: think acid plus dehydration plus potassium shift. 23. A patient on furosemide is being monitored for complications. Which findings indicate adverse effects? Select all that apply. A. Hypokalemia. B. Ototoxicity. C. Hypotension. D. Hypernatremia. E. Muscle cramps. F. Hypercalcemia. Answer A, B, C, E. Rationale: loop diuretics waste electrolytes and may cause hearing loss. Strategy: choose electrolyte loss symptoms. 24. A client with rheumatoid arthritis presents with which findings? Select all that apply. A. Morning stiffness. B. Symmetrical joint swelling. C. Rheumatoid nodules. D. Fever. E. Weight loss. F. Pain relieved by activity. Answer, A, B, C, D, E, F. Rationale, RA is systemic and inflammatory, activity improves stiffness. Strategy, recognize systemic autoimmune signs. 25. The nurse suspects internal bleeding after surgery. Which findings support this? Select all that apply. A. Tachycardia. B. Decreasing hemoglobin. C. Firm distended abdomen. D. Hypotension. E. Warm, flushed skin. F. Restlessness. Answer, A, B, C, D, F. Rationale, internal bleeding shows shock symptoms plus abdominal distension. Strategy, look for early shock restlessness. 26. A patient with hypermagnesemia shows which manifestations? Select all that apply. A. Hypotension. B. Bradycardia. C. Depressed deep tendon reflexes. D. Respiratory depression. E. Tetany. F. Lethargy. Answer, A, B, C, D, F. Rationale, magnesium acts as a CNS depressant. Strategy, avoid selecting hyperexcitability signs. 27. The nurse is caring for a patient with septic shock. Which interventions are essential? Select all that apply. A. Broad-spectrum antibiotics. B. Large-bore fluid boluses. C. Vasopressors. D. Measure lactate levels. E. Administer sodium bicarbonate routinely. F. Source control, drainage, removal of line. Answer, A, B, C, D, F. Rationale, early goal-directed therapy includes fluids, vasopressors, antibiotics, and monitoring lactate. Strategy, remove routine bicarbonate unless indicated. 28. The nurse suspects compartment syndrome. Which findings confirm this? Select all that apply. A. Paresthesia. B. Pain unrelieved by opioids. C. Pallor. D. Pulselessness, late sign. E. Pressure increasing. F. Pruritus. Answer, A, B, C, D, E. Rationale, 6 Ps, pain, paresthesia, pallor, pulselessness, pressure, paralysis. Strategy, remove findings unrelated to circulation. 29. A patient with anemia of chronic disease may exhibit which manifestations? Select all that apply. A. Fatigue. B. Pallor. C. Exertional dyspnea. D. Brittle nails. E. Tachycardia. F. Jaundice. Answer, A, B, C, E. Rationale, ACD causes mild, moderate anemia symptoms, brittle nails and jaundice are from other anemias. Strategy, choose oxygen deficit symptoms. 30. The nurse monitoring a patient with COPD exacerbation may observe which abnormal findings? Select all that apply. A. Use of accessory muscles. B. Pursed lip breathing. C. Barrel chest. D. Tripod position. E. Prolonged expirations. F. Slow, shallow respirations. Answer, A, B, C, D, E. Rationale, COPD increases work of breathing and causes air trapping. Strategy, think air trapped and working hard. 31. The nurse is monitoring a client with acute pancreatitis. Which lab findings support this diagnosis? Select all that apply. A. Elevated amylase. B. Elevated lipase. C. Elevated glucose. D. Low calcium. E. Elevated potassium. F. Low albumin. Answer, A, B, C, D. Rationale, pancreatitis causes high pancreatic enzymes, hyperglycemia, and hypocalcemia. Strategy, identify labs showing inflammation and poor digestion. 32. A patient with heart block is being monitored. Which ECG findings may occur? Select all that apply. A. Prolonged PR interval. B. Dropped QRS complexes. C. Long QT interval. D. Irregular P2P rhythm. E. Variable PR interval. F. Tachycardia. Answer A, B, E. Rationale: heart block affects AV conduction, leading to prolonged/variable PR intervals and dropped QRS complexes. Strategy: focus on AV node conduction delays. 33. The nurse is assessing a newborn with respiratory distress syndrome. Which findings are expected? Select all that apply. A. Nasal flaring. B. Grunting. C. Expiratory wheezes. D. Intercostal retractions. E. Cyanosis. F. Low respiratory rate. Answer A, B, D, E. Rationale: RDS shows increased work of breathing, wheezes are not typical. Strategy: eliminate findings associated with asthma. 34. A patient receiving digoxin shows toxicity. Which findings confirm this? Select all that apply. A. Nausea and vomiting. B. Yellow-green vision. C. Bradycardia. D. Hyperkalemia. E. Confusion. F. Hypertension. Answer A, B, C, E. Rationale: digoxin toxicity, bradycardia, GI upset, visual disturbances, confusion. Strategy: think GI plus neuro plus cardiac slowdown. 35. The nurse caring for a patient with peritonitis expects which findings? Select all that apply. A. Board-like abdomen. B. Rebound tenderness. C. Hypotension. D. Absent bowel sounds. E. High-grade fever. F. Hyperactive bowel sounds. Answer A, B, C, D, E. Rationale: peritonitis equals inflammation plus shock, silent abdomen and rigid abdomen. Strategy: remove anything indicating increased bowel movement. 36. A patient with meningitis is being assessed. Which clinical signs are common? Select all that apply. A. Nuchal rigidity. B. Photophobia. C. Positive Kernig sign. D. Positive Brzezinski sign. E. Hypertension with bradycardia. F. Hyperactive reflexes. Answer A, B, C, D. Rationale: classic meningeal signs include neck stiffness and positive neurologic tests. Strategy: distinguish from Cushing's triad. 37. A client with SIAD is being monitored. Which assessments are expected? Select all that apply. A. Low serum sodium. B. Low serum osmolality. C. High urine osmolality. D. High serum potassium. E. Weight gain. F. Polyuria. Answer A, B, C, E. Rationale: SIAD water retention, concentrated urine, dilutional hyponatremia. Strategy: think low serum, high urine. 38. The nurse is evaluating complications of immobility. Which findings are associated? Select all that apply. A. Pressure injuries. B. Muscle atrophy. C. Hypercalcemia. D. Constipation. E. Increased cardiac output. F. Urinary stasis. Answer A, B, C, D, F. Rationale: immobility affects skin, muscular, cardiac, urinary, and GI systems. Strategy: remove things showing increased activity. 39. A client with COPD is receiving oxygen therapy. Which interventions are appropriate? Select all that apply. A. Titrate oxygen to maintain SpO2 88 to 92%. B. Use Venturi mask. C. Encourage pursed lip breathing. D. Provide high-flow oxygen at 15 liters per minute. E. Monitor for CO2 retention. F. Increase carbohydrate intake. Answer A, B, C, E. Rationale: COPD needs controlled O2 delivery and monitoring. Strategy: avoid high-flow O2 unless emergency. 40. The nurse is reviewing signs of hypoglycemia in a conscious diabetic patient. Which findings are common? Select all that apply. A. Sweating. B. Tremors. C. Confusion. D. Hunger. E. Deep, rapid respirations. F. Irritability. Answer, A, B, C, D, F. Rationale, hypoglycemia equals sympathetic plus neuroglycopenic symptoms. Strategy, eliminate signs of DKA. 41. The nurse caring for a client with end-stage renal disease expects which findings? Select all that apply. A. Pruritus. B. Elevated BUN. C. Low erythropoietin. D. Hypokalemia. E. Metabolic acidosis. F. Hyperphosphatemia. Answer, A, B, C, E, F. Rationale, ESRD leads to toxin accumulation and electrolyte abnormalities. Strategy, remember, kidney fails, everything builds up. 42. A client receiving opioids is being monitored for adverse effects. Which findings require immediate attention? Select all that apply. A. Respiratory rate less than 10. B. Pinpoint pupils. C. Hypotension. D. New confusion. E. Constipation. F. Nausea. Answer, A, B, C, D. Rationale, respiratory depression and altered LOC are emergencies. Strategy, prioritize airway plus consciousness. 43. The nurse is teaching about infection prevention in neutropenia. What should be included? Select all that apply. A. Avoid raw fruits. B. No fresh flowers. C. Wear a mask in public. D. Avoid large crowds. E. No live vaccines. F. Take NSAIDs for fever. Answer, A, B, C, D, E. Rationale, neutropenia requires strict infection control. Strategy, eliminate fever-masking agents. 44. A patient with left-sided heart failure presents with which manifestations? Select all that apply. A. Crackles. B. Pulmonary edema. C. Orthopnea. D. Jugular vein distension. E. Pink frothy sputum. F. Ascites. Answer, A, B, C, E. Rationale, left HF affects lungs, JVD and ascites are right-sided HF. Strategy, left equals lung. 45. The nurse is caring for a burn patient in acute phase. Which findings require intervention? Select all that apply. A. Hyponatremia. B. Hyperkalemia. C. Elevated hematocrit. D. Decreased urine output. E. Fever. F. Hypoglycemia. Answer, A, B, C, D. Rationale, fluid shifts lead to electrolyte imbalance and hemoconcentration. Strategy, select findings related to massive fluid loss. 46. The nurse assessing a patient with DVT expects which symptoms? Select all that apply. A. Calf pain. B. Warmth. C. Swelling. D. Redness. E. Loss of pulse. F. Positive Homan sign. Answer, A, B, C, D. Rationale, DVT local inflammation, pulselessness suggests arterial occlusion. Strategy, avoid outdated tests like Homans. 47. The nurse caring for a patient with hypovolemic shock expects which findings? Select all that apply. A. Tachycardia. B. Hypotension. C. Cool skin. D. Increased urine output. E. Weak pulses. F. Bounding pulses. Answer, A, B, C, E. Rationale, in hypovolemia, cardiac output drops cold, weak pulses. Strategy, remember decreased perfusion signs. 48. The nurse caring for a patient in alcohol withdrawal expects which symptoms? Select all that apply. A. Tremors. B. Hypertension. C. Tachycardia. D. Seizures. E. Hypothermia. F. Hallucinations. Answer, A, B, C, D, F. Rationale, withdrawal is hyperactive, not depressed. Strategy, select CNS excitation symptoms. 49. The nurse is teaching a patient with chronic anemia about expected symptoms. Select all that apply. A. Fatigue. B. Pallor. C. Cold intolerance. D. Tachycardia. E. Hypertension. F. Smooth, red tongue. Answer, A, B, C, D, F. Rationale, anemia reduces oxygen carrying capacity. Strategy, identify low oxygen symptoms. 50. The nurse assessing a patient with pulmonary embolism expects which manifestations? Select all that apply. A. Sudden dyspnea. B. Chest pain. C. Anxiety. D. Tachycardia. E. Hypotension. F. Bradypnea. Answer, A, B, C, D, E. Rationale, P equals acute respiratory plus cardiac compromise. Strategy, look for sudden onset plus hypoxia.
That brings us to the end of today's session. If you found this video helpful, please like and subscribe so you can receive more content just like this. Don't forget to check out our previous videos as well. They're packed with valuable information to help you prepare effectively for your upcoming exam.